Hi everyone, Dr. Knackstedt. I think one of the aspects of surgery that can really negatively impact patients that we very often forget about are the financial implications of having surgery. When we think about what a surgery costs, the first thing is to consider whether or not it's covered by insurance or it's something that's elective that you're paying for out of pocket. I do mainly breast reconstruction, so almost all of the cases that I perform are covered by insurance. But depending on your healthcare plan, you can still have very high deductibles. So it could still be a tremendous financial burden for a patient to have a surgery that is still covered by insurance. Then you have copays associated with doctor's visits, you have medications you have to buy, you might have wound care supplies you need, maybe home health. So all of that can be very, very expensive even though the surgery was covered by insurance. And then apart from that, we have opportunity cost. We have the fact that you're not working, you're taking time off work, which you may or may not be getting paid for. You might have to pay for things like childcare if you can't take care of your children while you're recovering. You might have to pay for things like grocery delivery if you're unable to go grocery shopping. And then we think about all of your post-operative visits. Some of my patients come from 10 hours away, so that's a plane ride or that's gas, that's a hotel stay. All of these things can really add up. And there have been studies looking at that it's in breast reconstruction, looking at the financial fatigue that patients experience even when they're having surgeries that are covered by insurance. And I've had patients tell me, and it breaks my heart, where they want to have some type of revision surgery for their breast cancer reconstruction, but they just can't afford it. So what can you do if you're in this situation? Well, the first thing is just to be honest and open with your surgeon and express your concerns. When I have a patient that brings up these concerns to me, I put them in touch with social work so they can talk about resources that might be in the community for this patient to benefit from. And then we also do some strategic surgical scheduling. So if there's a way that I can get their reconstructions done in 1 year where they have met their deductible, then I really do try to do that. But if this is something that you're struggling with as a patient, please ask your surgeon because there are resources that our team can put you in contact with to try to help you on this journey. Has this been something that you've experienced? Has there been any resources that have helped you? If so, let me know below.